A lot of times that deep anterior fascial line from your tongue to your toes, think of it like a scrunchie. And when you stretch out that scrunchie, the fabric is nice and smooth and you can kind of move it around. But when it is tight and pulled taut, that fabric wrinkles up. And that's what our babies are doing. So that's when you see that flexion pattern or perceived torticollis with our tongue-tied babies.
Welcome to Mothering from Within, the podcast where we dive into the heart of parenting during those magical yet challenging first few years. I'm Kaili, a mama of two, a pediatric occupational therapist, and your guide on this beautiful journey of motherhood. Every week, we explore the wonders and hurdles of motherhood with curiosity, we gain clarity around our babies, and find the courage to trust our instincts. If you are a mama who wants to do motherhood your way, confidently, courageously, authentically, then you are in the right place. So grab a cup of tea, tuck those little ones in for a nap, or bring them along for the ride. It's time to get curious, gain clarity, and unleash your courage to do motherhood your way. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or healthcare provider. Hello and welcome. I am so excited to welcome you back to Mothering from Within. And today I have a very special guest. Her name is Kelsey, and she is on Instagram, BWellTOTs. She is also an OT. She works with babies and toddlers, and she works a lot with development and tongue ties and the oral motor piece. So I think this is going to be a super fun and exciting chit chat because we have a lot of things in common. So welcome, Kelsey.
Thank you so much for having me. I love doing podcasts and just chatting with other providers and especially connecting with other OTs. So thank you so much for having me. I started as BWellOT. My last name and my husband's last name both start with B. And I was kind of focusing around wellness. And I was like, sure, BWellOT. Like, that's cute. It's great. And then last year, I brought on a PT, another OT, and a speech therapist. So I needed to make it a little bit more broad. And I thought TOTS was appropriate because I work in the tethered oral tissue space. And that's an acronym we use frequently. But it's also something kind of endearing about little kids and all that cute stuff. So it turned into BWellTOTs, and we've rebranded. And I would never recommend that to anyone because changing your email a million times is really annoying. But we did it, and I'm glad we're here.
Amazing. That's such a fun little transition. Okay, so why don't you tell us a little bit more? I know that you mentioned that you're an occupational therapist and that, now you're running this business that has various different specialties in it, which is amazing. But I want to know a little bit more about why you started your business and what was sort of the driving force behind that.
Yeah, so many things on my meandering path have kind of led me to where I am. And I think so many entrepreneurs can relate to that. But I started as a PT grad in school, actually, and then I transitioned to OT because I felt like it was more holistic and fun, to be honest. And when I graduated, I worked in early intervention. So I always worked in pediatrics. That's what I knew I wanted to do. And I knew that feeding was a big need of a lot of the kids that I saw in introduction to solids, some basic nutrition. So I went into the SOS and a lot of talk tools courses and all that fun stuff. And I had a wait list in early intervention for feeding therapy because I was so full, and I was one of the few doing it in Philadelphia where I am. And then when I got pregnant with my daughter, I was like, oh, I should look into lactation because this will serve me professionally and personally. And as OTs, that's what we do, right? We take trainings to further our knowledge for our, professionalism as well as ourselves.
True.
So I got my CLC, and that was helpful and gave me a little bit of a foundation. But when I had my daughter, I realized I knew nothing. And even though I was a pediatric occupational therapist, feeding specialist, and lactation counselor, I was struggling. So I knew that if I was struggling, that everyone else was going to be struggling, maybe more, but I was struggling a lot. So I figured it out. We had a beautiful 2.5-year breastfeeding journey together. And part of that journey was that she never took a bottle. a day in her darn life. She never took a bottle. Hindsight's 2020. I see all of the things that I could have done differently, and she needed extra supports in and all of those all of those pieces. But I was doing the best I could with what I knew at the time. And she was thriving in many ways, not in all the ways that I would look at now, but in many ways. Throughout that process, it taught me a lot, obviously. And then I got into some pelvic floor stuff as I was going through my postpartum.
I've put together a free tongue tie symptoms checklist that you can download using the link in the show notes below. It's a quick and easy way to track what you're seeing and to start connecting the dots between feeding, reflux, sleep, and other symptoms that might be related to a tongue tie.
I was taking the functional pelvis trainings and working on my own rehab and getting her where she needed to be. And developmentally, she's always done great. But then at some point, when I got back to work, my friend at school drop off for my oldest, who's my stepson, is a lactation consultant. And she was like, Kelsey, you're an OT and you work with babies? And I was like, that's what I do. And she's like, do you know about tongue tie? And I was like, I mean, I know about them, but I'm not like trained in them. I don't really know what you're talking about. And then she was like, you need to do some reading on this and come back to me. And then you're going to be the OT that my practice basically refers to. And I was like, okay, I'll do that. So thank you, Rachel Gazda, IBCLC, for telling me to start my business. She's amazing. And she kind of put me on this niche path, and it opened the door to the tongue tie world. And I've really taken it and gone deep down the rabbit hole. And my practice is very nervous system and airway based. So we all look at those factors and how they relate to behavior and sensory processing and development, right? And all those gross motor things. So it's been a little bit of a journey, but I started seeing people in homes similarly to early intervention, but as a private pay practitioner, and built my business up from there. And then just this past January, I got keys to my first solo clinic space, and I have my 3 practitioners, and we're trying to have a really holistically minded, comprehensive hub. And then I have some really amazing providers in my very unofficial referral network that I work closely with. We share cases back and forth and are able to really brainstorm and help families in the ways that are going to move the needle the most, right? Mm-hmm. Instead of just kind of like throwing spaghetti against the wall. So I'm really fortunate for all the connections that I've made.
Oh, I love that. And for those of you listening, for this whole time, I've been nodding because I resonate so much with your story. I have a very similar story where, you know, you have your first baby, and even though you have spent many, many years working with babies and young children as an OT, you still, like, I had that same feeling of like, what
did I do?
Way harder than I thought it was going to be. And so that's part of my story too, as to why I started working primarily with babies, and then of course moms and families as a result. So I just wanted to let all the listeners know that I've been just nodding my head and laughing along, because I think many of us therapists actually have very similar stories. And a lot of the time we start our businesses out of a need that we had. And that has driven our passion and what we want to continue to learn about, and then also to support moms and babies and families and babies, because I think that this is really an important area. And tongue ties especially, because that's what we're going to kind of focus on today, but tongue ties especially was something that I did not know anything about when I had my first baby, even when I had my second baby. And then about 2.5, maybe 3 years ago is when I kind of was like, wait, this tongue tie thing seems to be on my radar more. And I started getting trained in it. And then I was like, oh, right. All those things make sense now. So it has been a journey with my own children and also with myself. We all got our tongue ties released at the end of 2022. So that's been a whole journey as well, which has been an interesting one. So let's dive into this world of tongue ties. I think that Well, I'm making a big assumption. I think that most listeners probably have heard about this concept by now because it has become a little bit more trendy over the last few years. It's being talked about a lot more because it's being assessed more. I think there's two sides of the coin here where there's also a lot of controversy in this field. So let's chat about tongue ties and maybe just give us a quick overview of what our tongue ties are. Actually, let's start with tethered oral tissues because it's not just all about the tongue.
Yeah. So a tethered oral tissue is a restrictive frenulum, right? We all have frenulum. We have one on our upper lip, upper and lower cheeks on both sides and under our tongues. And they give us structure and stability, and they're not all bad. But sometimes they can be too restrictive and inhibit function. And that's when it's considered a tie, right? So my job to determine how much it's impacting function, that's usually where I come into play and see how much of it is the actual restricted frenum versus maybe some lower muscle tone, or is it more due to a high palate because of low tone and the tongue isn't getting up there, but the frenum is there, sure, but it's not necessarily the why, right? Even if we released that frenum, maybe it wouldn't make that much of a difference because the tongue doesn't know what to do. So we have to train the tongue to know what to do. And that's where that neuromuscular reeducation and therapy piece comes in. A lot of times you hear about reducing tension when it comes to tethered oral tissues, and people are recommending chiropractor and cranial sacral therapy and massage and body work and all of those things. And while those things are wonderful, I'll never say don't do them, but there is a missing piece when you're just doing the manual therapies, like the body work and reducing tension. You have to work on the strengthening piece. You have to re-educate and work on that neurosensory motor, paradigm to get these muscles functioning, because the frenum isn't always to blame. And I think that's where we have a lot of drama and a lot of dispute, because there are releases done that aren't necessarily necessary, unfortunately, when providers don't have that full comprehensive education, and maybe families haven't been given the opportunity or the education to know that ideally we are doing pre-op therapy, hopefully going to a reputable provider and having post-op work as well that isn't just body work.
Yeah, I think that brings up a good point that it's not just about the tongue tie, right? Like often there's other things going on as well. So it does take a team. And that's an important piece for parents to really understand. I think on the one side, we have the release providers who are just kind of releasing all the tongue. But on the other end, I also see a lot of providers who say, oh, there's a mild tongue tie, or it's just there a little bit, or whatever it is. And then they don't end up giving parents this indication that it is a tongue tie and it should be something that you're looking more into. I think that we run into this piece of providers saying, oh no, that's fine. It's got enough structural kind of mobility. I'm not seeing anything major. It's a minor tongue tie or it's whatever grade. But what they're missing there is the function. Is the function actually what the tongue should be doing, or what the lips should be doing, or what the cheeks should be doing? And not necessarily that that should be released right away, but those dentists or doctors or whoever are doing the assessing should be referring to the right people. That shouldn't ever just be like, oh, that's a mild tongue tie, don't worry about it. Or your child can stick out their tongue, don't worry about it, it's fine.
Yeah.
There's a lot more that goes into this assessing what the function of the tongue actually really is. What is causing that dysfunction of the tongue? Is it the frenulum, or is it body tightness somewhere else? Or is it cranial nerves that are being pinched? Or is it low muscle tone? Or is it whatever? The tongue just doesn't know what to do. So I think that's a really important piece of the puzzle. And so I hope that parents take away from this, just this brief little introduction chat, that it's never a black or white thing with the tongue ties. Like we really want to make sure that you're seeing the appropriate people to get the full picture.
Yeah. And I think that's where a lot of frustration comes in because a lot of times when you are dealing with, oral dysfunction and feeding difficulties, it's really stressful, right? Baby's uncomfortable, feeding parent is uncomfortable, maybe weight gain is a concern. Like all of these really stressful things are happening, and you are naturally inclined to be like, this is the thing causing all of the issues, let's fix it, right? And I get it. I also think like that. Like I would like a quick fix for so many things.
Magic pill for you and you and you and you.
Exactly. Exactly. I really wish it was that. And in very, very few instances, it can be to some degree, but it's usually more than that, right? Like that's, 0.2% of these cases. And just as you were saying about, maybe some cranial nerve compression or, some body tension. I run a mentorship program and we had our cranial nerve discussion earlier today. So I had my night's little refresher, and it just shows us how impactful our pregnancy positioning can be, how impactful birth trauma can be. And when I say birth trauma, that is all birth, right? You can't have birth without some level of impact on the birthing parent and on the baby, right? That's just kind of unheard of in many ways, whether it be very, very minor or more significant. And movement is really helpful for those things. Movement is medicine. And there are so many times we really need to get the body moving to get it functioning better. And the babies that have a really hard time and have a lot of tension and are dealing with oral dysfunction are frequently, not all the time, but frequently very tight. So that's where that like tension release conversation comes in. But it's usually not all of that because the tension is a compensation for weakness almost all the time.
Yeah, so let's dive into a little bit more about maybe some signs and symptoms that there's something going on that's restricting that tongue function or that might indicate that your child does have some oral motor dysfunction, whether that's the tongue or the lips or the cheeks.
Yeah, great questions. Nipple pain is a big one, right? That's usually a big red flag, but there's something going on. And persistent nipple pain, right? Not just like, oh, you had an off latch and it was painful and then we readjusted and it was fine. But persistent nipple pain, really gassy or uncomfortable baby, reflux colic, persistent lip blisters, so that cobblestone appearance of the lips, open mouth posture, a baby sleeping with the mouth open, more drool than you would expect for a baby of that developmental age or stage. My tongue tie is showing, I'm mumbling. But there's so many different aspects. A lot of times you will also see a tilt or turn preference, and some level of torticollis is a really common correlation or connection to tethered oral tissues as well. And that is, again, connected to plagiocephaly, so some head flattening, right? So all of these things are connected. And the tilt or the turn is frequently what gets flagged the quickest because it's the easiest to see, right? They're like, oh, well, baby only likes to look in one direction. I'm like, well, you have two eyes and two sides, and we should probably look to the other side sometimes too. So we should work on that. But there's a lot more going on. And that also impacts feeding. If they only want to turn to one side, they're frequently going to prefer to feed in a very specific feeding position with the bottle, or they're only going to prefer to feed on one side if you're breastfeeding. So there's a lot that goes into, body alignment and analysis when we are looking at oral dysfunction.
I've put together a free tongue tie symptoms checklist that you can download using the link in the show notes below. It's a quick and easy way to track what you're seeing and to start connecting the dots between feeding, reflux, sleep, and other symptoms that might be related to a tongue tie. And so this is a good reminder that everything really is connected. It's never just the neck or a torticollis. It's never just plagiocephaly. It's never just the tongue dysfunction. It's a combination because one thing leads to the other thing, leads to the other thing. And it's really finding what that root cause almost is and what's going on in the body and how can we help all of those things. I think that this is something that parents and even healthcare providers miss, right? Where they're like, oh, that's fine. They just have a head turning preface. Doctor said it was nothing too much to worry about. And they're like, well, let's
Uh-huh.
reassess that. I love this reframe that we have two eyes. We're meant to look in both directions of the body. Um, there's a reason there's the tightness or something is going on to restrict, and that neck is either potentially the cause or often that's actually coming from the hip. It's like a whole sided thing. And then that
Yeah.
is then causing all these other things like only being in one position and then having that sort of flat head syndrome. I would love to dive a little bit more into this correlation between tongue tie and torticollis and how those two are related, correlated, and what you see in your
Yeah.
practice related to those.
Yeah. So there are 3 different official diagnoses of torticollis. And truthfully, I've only seen 2 true torticollis cases that I can identify. Most of the time, our torticollis cases are in uterine constraint pattern, right? And we have a full sided tension pattern, and we have like a lateral side bend through, and sometimes some rotation through the core and the trunk. Your hip is impacted, as you were saying. And then we also have our cervical lateral flexion and rotation, and we have differing degrees of where that shows up, right? And so many times our babies with ties are babies that don't move frequently in utero for one reason or another, right? We don't necessarily know why. It could be maybe very petite birthing parent and they didn't have a lot of room, or maybe there's just less movement overall, but for whatever reason, they don't move quite as much as we would like. Not in a medically concerning way that's getting flagged by any means, but they just kind of get cozy in one spot and they want to stay there for a while. And then when they come out, they want to go back in that position because they were in the most comfortable, cozy little jacuzzi for, 9, 10 months. And they're like, but I would like to be back there because that's how my body literally grew and formed. And now I don't really know where I am in space with gravity. So most of the time, when you have some level of strain, right, you're going to want to be comfortable, and parents don't want to make their babies uncomfortable. So they're going to keep them in that position, and it perpetuates and turns into more muscular tension. And this isn't to blame parents by any means. This is just kind of a lack of education and societal norms, right? And then we add in more containers and baby kind of falls into their preferred position in these containers that are all the same thing in various capacities. So,
That's a whole other
oh
episode.
gosh, it could go on forever. But there's so many perpetuating factors where we can intervene, but societally and culturally, we don't. And at some point, it becomes significant enough that there is a red flag drawn. But to kind of go back and actually answer your question, sorry, I went on a little bit of a tangent there. A lot of times that deep fascial line, your anterior fascial line from your tongue to your toes, kind of think of it like a scrunchie. And when you stretch out that scrunchie, the fabric is nice and smooth and you can kind of move it around. But when it is tight and pulled taut, that fabric wrinkles up. And that's what our babies are doing. So that's when you see that flexion pattern or perceived torticollis with our tongue-tied babies.
Yeah, well, and it's interesting because then if we go back even more in development, like in uterine development, I think the tongue is one of the very first things to form. And if the tongue is not moving properly, then that also leads to the body not moving as well in utero. And so this is where that kind of correlation comes from. There's so many factors. It's like the chicken and the egg, like what came first, but they're all kind of interrelated. So, and it's not anything that a parent could foresee or fix in utero. So don't even go there.
No.
It's not your fault. There's nothing that you could have done to prevent it. It's just how those cells formed and were forming and how your baby grew in utero. And there's absolutely nothing that you did wrong to cause this.
No.
So I'm just putting that on the table there because I often do get a lot of parents who feel guilty that somehow they did or didn't do something that then caused this, and now their baby is not thriving the way that they imagined they would, right? So we're not going to put any blame on ourselves. We're just going to say, this is what it is. This is what was meant to be. This was the baby that we were meant to have. And we're going to move forward.
Oh, 1,000%.
Because I think that's a big piece. Yeah.
Yeah.
So I would love to chat a little bit going back to this idea of this mouth open posture and mouth breathing, because this is another huge piece that I see get missed a lot. And I run mom and baby classes, and I can't even tell you how many babies I see in my classes that have this open mouth posture, and parents just aren't even aware. So, gently I try to bring some awareness to that. However, it's a bit of a touchy subject. So let's dive into that subject.
Yeah. My friends always get really annoyed with me when we walk anywhere. And I just can't stop assessing babies in strollers or carriers and their positioning, and then the parents' gait analysis and like all this stuff. And this is not from a judgmental place, but just like my brain can't turn this off space, and I pick up on these things. So I also run classes and I pick up on these things. But yeah, the open mouth posture is kind of an epidemic. I mean, we could really go into a deep dive on so many different things here, but at baseline, we should be breathing through our noses with our tongues suctioned to our palates and our lips closed, right? Our tongues are our built-in palate expanders, but if they are restricted and they can't elevate to the palate, they can't help form it. They can't do their job. So we really need to get the tongue functioning better so that it can tell the palate to grow how we want it to grow, and it can allow the jaw to grow forward and up and broad rather than small and recessed and back, because that's going to compress our airway space. And if you think about your sinus cavity, the roof of your mouth is the floor of your nose. So if you have a high vaulted palate or a high bubble palate or whatever level of high palate you have, your nasal cavity is smaller than it should be, right? So that means that nasal breathing is harder than it could be, which means you're more likely to revert to mouth breathing, which leads to more inflammation of your tonsils and adenoids, leads to a higher palate, more low tongue posture, potentially angling of your eustachian tubes for more chronic ear infections, sleep disordered breathing, and then long-term malocclusion, crowded teeth, migraines, TMJ, like the list goes on, and all of these things are connected.
Yeah, it's something that is now starting to come more out into the general public, which is amazing. I love that more awareness is being put on all of these pieces that are connected. It's such an important piece, this airway piece and this breathing piece. It's just so unfortunate, though, that there are still so many providers that have that direct access, like dentists and pediatricians, who see patients on a regular basis, because that's just the nature of our society. Everybody goes to the dentist, everybody goes to the doctor. Not everybody goes to see an occupational therapist, right? I think that there's that bit of disconnect in these main professions that really could be checking off these red flags and saying, oh, I'm noticing XYZ. I would love for you to go and get an assessment done over here. So hopefully that will start to come now that we're bringing more awareness to it. But yeah, so this is a really big piece of the puzzle, because a lot of the time I also see those babies that are a little bit more highly sensitive and that have, and even my own son, this is definitely part of the thing that was going on with him, but he's just a little bit more anxious. He has meltdowns more frequently. He's 8 now, but we've been dealing with this since he was a toddler. And part of that is because he has spent so many years with this mouth breathing that I didn't know anything about until just a few years ago. And so now we're trying to kind of correct that. But the mouth breathing also doesn't filter. So you mentioned it doesn't filter the air properly. So it does lead to more of the tonsils and the adenoids, which are essentially our immune system. Often when we mouth breathe, we are breathing more from our upper chest area, thoracic area, versus doing more of that sort of quote unquote deep belly breathing, right? Which then triggers that kind of rest and digest, that parasympathetic system, to just kind of calm our system. And so I'm seeing this a lot where these babies, toddlers, preschoolers, children
who maybe even have a diagnosis and they are a little bit more anxious. They have various sensory sensitivities, and that's a whole other thing too. But again, you're looking at which came first, chicken or the egg. A lot of them are mouth breathers. A lot of them potentially have undiagnosed tongue ties. A lot of them might have the high pout. There's so many layers.
It's an endless amount of layers, honestly. And yeah, both of my kids have ties. I didn't know all of the things that I know now back then, obviously. My stepson is 10. And so his first year of life was much different than my daughter's. Different set of parents, different circumstances, different all the things, right? And my daughter, now 7, almost 8, she never took a bottle, as I said. And that was her expression of her dysfunction from that tie. And my favorite joke to share with parents is if I'd known my kids were going to have ties from their dad and I saw that on Tinder, I probably wouldn't have gone on the date. Just kidding. I love him. He's great. But there's such a strong genetic component there, right? So I could have had the best diet and the best movement and all of those things, and my daughter still was going to come out with ties, right? So as you were saying before, this is a guilt and shame-free zone. You did nothing. It's just how the genes are telling those cells to divide, unfortunately. And it's in a suboptimal way. So our job, once baby's here, is to help optimize what they have and potentially change that biomechanical restriction through a tongue tie release and some palatal expansion and whatever else is going to be indicated for that unique case. My daughter, 7, she has an expander and she has very, very mild speech things that I pick up on, or a speech therapist might if they were paying attention, but totally fine. Has never received true speech therapy. And she, with her expander in, I always thought she was a pretty good breather. She never had consistent snoring or open mouth posture, mostly because I was in there trying to keep that tongue up as much as I could, even when she was 4, 5, 6, even 7. But
I'm still doing that with my kids.
Yeah,
get that tongue up
can't
there.
stop, won't stop. But she sleeps so much better. And she was a pretty good sleeper. She was an awful sleeper as an infant, which makes sense. She could only really sleep if she was nursing, so I didn't sleep for a long time. She's a great sleeper now, and she wakes up rested for the most part. I mean, everybody has their days, but her sleep quality has greatly increased. And for my son, who's 10, he definitely is on the ADHD, a little bit of outburst. He's got a lot of stuff. So sweet and so smart. And also, definitely my more sympathetic dominant, more reactive, as you were saying, more meltdowns as a little one, even though my daughter had plenty, but different. And his frustration tolerance has improved since getting the expander. Even with no direct therapy around that, he's better able to kind of regulate and work through things faster since getting his expander in. So that's anecdotal. That's my personal experience and, his personal experience that I'm observing and not research by any means, but it is very much all connected.
Yeah. Oh my gosh. Everything is connected. And the more you learn, the more you're like, oh yeah, that makes sense because that's connected to this. So that's good. Why I'm sure you are similar, but this is why I am constantly going on learning new courses and reading new books, and just I'm always looking for new things to learn. I call myself the course junkie because I have taken so many courses over my career as an occupational therapist that it's mind-boggling.
Yeah, I told myself I was going to be paused on trainings for the rest of this year. I took so many trainings last year. I already signed up for one.
It's hard.
Yeah.
It's hard to say no.
Well, actually, I mean, this will be my second one. I don't know. I'm awful.
Love it.
I think that there does need to be, just as a little aside, right? Being a course junkie and a lifelong learner is so, so important, and you need to keep expanding those things. But there does come a time where you're like, no, I know this, right? And every new course that you take is just more confirmation rather than new material. So I think that when it comes to therapists that might be listening, knowing that you know more than you think you know And building up your confidence is just as important as increasing your knowledge
Mhm.
base. There's a time for both. So I just want to put that out there because I feel like as OTs, we're constantly like, well, I don't know that much about it and I need to learn more,
Sure.
even though you know so much more.
Gosh, I love
So
it. Yeah, we
just
definitely
just
have a
support.
very similar brain. Um, so I actually I want to clarify something for families because we talked a lot about tongue ties. We talked a lot about this development piece and how everything is sort of connected. And we mentioned this idea that we do need to retrain these muscles to do what we want them to do. So retraining the tongue, for example. It's so important. Now, who do you go to get that tongue retrained? Because it's very different for babies than it is for older kids. And a lot of the time, dentists will say, oh, yeah, just go and find a myofunctional therapist. That is generally the profession who does this sort of quote unquote tongue retraining. And the thing with that, though, is that myofunctional therapists work with children over the age of 4 because it is an active therapy that requires cognitive ability to follow and motor plan directions in your mouth. So it's literally like, okay, move your tongue this way. Okay, move your tongue that way. Okay, do this now. Do this now. And so myofunctional therapy is not what you're looking for when you have a baby or a toddler. When you have a baby or a toddler, you're going to be looking for an occupational therapist, a speech language therapist, sometimes a physical therapist who has specific training in this oral motor area. So, like tongue, lips, cheeks, and tethered oral tissues and restrictions. Would you agree?
Oh, 1,000%. I think your gold standard person is ideally going to be a therapist, OT, speech, PT, as you said, with an extra credential of lactation, CLC, CBS, IBCLC, and then also a layer of body
Mm-hmm.
work, whether that's myofascial release, massage, cranial sacral therapy, whatever it may be. But that's kind of your
Mm-hmm.
trifecta. That would be your
Yes.
ideal. For me, I'm an OT, I'm a CLC, and I practice myofascial release and cranial sacral therapy and so many other manual therapies. They all blend together, right? So that's ideally who you're looking for, or you have to kind of piecemeal that together. So then you might be going to see a PT for body stuff, and then a speech therapist for the oral piece, and then a lactation consultant for your feeding, even if you're
Mm-hmm.
bottle feeding or even if you're working with solids. Sometimes that's more speech therapy. It really
Mm-hmm.
depends. That's the confusing part because it's very provider specific. Um, just because you and I are OTs and we work with babies, we're going to work with babies very
Mm-hmm.
differently, right? That's just the nature of being a
Yes.
therapist and working with bodies. We come at it from our own perspectives and with our own spice and
Yeah.
whatnot. But I think the hard part is you can't just say, oh, you need these credentials. Like, you need to kind of pull from those 3 buckets and see what you can best find.
Mm-hmm. Yeah. And it's important to ask questions, right? To know kind of what you're looking for and then ask questions to make sure that the provider is in line with what you need. So that's also really important. Okay. So we're reaching the end of the episode because I'm conscious of time and I want to keep these digestible and not too long and overwhelming. I have some rapid fire questions for you, and I did not warn you about these. What is your favorite way to prioritize taking care of yourself during the day or the week?
That's hard. I wake up early to get my movement in because that helps regulate me for the rest of the day. And if I don't do that, my energy is off. Like, I'm not in a great mood. And it very much is for my mental health and also just feeling confident and in control of my body. Because if I'm folding babies all day, I don't want to be unsure where my body is in space. So that's really important to me and trying to get to bed on time. So my morning movement practice, whatever that may be, and getting to bed at a reasonable time.
Love it. What is one piece of advice that you got in your first few years of motherhood that really stands out for you?
I was really fortunate that I had a wonderful midwife and I had a beautiful home birth, and she was so, so patient with me, thinking I knew more than I did. And she really guided me to listen to my gut and listen with my heart rather than my brain and overanalyze everything.
Oh, that is so important. Everybody, make sure you listen to that multiple times because that is really such an important piece of advice is to listen to your gut, your heart, and really trust that. Trusting that is a whole other ballgame. But yes, okay.
Yes.
If you had a magic wand, what would you use it for and why?
Closing baby's mouth.
I love it.
Every baby I see on the street.
Magic pill for you and you. Yeah, the good one. What's the biggest takeaway that you hope listeners kind of learn from today's episode?
If you hear one thing, I want it to be that what is common is not necessarily normal, right? And open mouth breathing is not normal, and we should do something about it. Even though it's not an emergency in this moment, it is something to be addressed.
Mm-hmm.
That doesn't mean that it's an emergency. It doesn't mean that there's something wrong, but it's information that things could be better.
I'm going to add to the open mouth breathing because it kind of goes hand in hand, but also baby snoring is common, but it's not normal, and it is indicating that there is something else going on. Often those two go hand in hand. But that is another one of those that you're like, oh, it's so cute. Listen to that snore. And you're like, no, that's not cute.
I know.
Or at least it won't be cute after you listen to this episode.
Right. Exactly.
Last thing, where can listeners learn more about you?
I'm most active on Instagram. So I'm BWellTOTs on Instagram. So you can find me there and it'll direct you to my website, also BWellTOTs.com, and all the other places that you can find me.
Amazing. And I will add all of those in the show notes as well. Thank you so much for being here. It has been a joy chatting with you and learning a little bit more about the tongue ties and how those affect development and some key takeaways for parents in terms of just being more aware of what all of this means and how to get the support that their baby might need. So thank you for being here and sharing your time with us.
Thanks for joining us today on Mothering from Within. If today's chat sparked something inside of you to explore your motherhood journey deeper, the Mothering from Within Collective is waiting with open arms. This program offers an intimate, high-touch coaching journey designed to empower you with the confidence and clarity to embrace motherhood on your terms, free from guilt. Get curious about your parenting values, gain clarity on your baby's sleep, development, and more. With comprehensive courses, one-to-one support, group Q&As, and a nurturing community. This is your invitation to join a community of mamas doing it all their own way. Supported, seen, and held. Visit the link in the show notes to learn more about the collective and how we can walk this beautiful path together. Until next time, stay curious, embrace clarity, and let your courage shine.